Bismillahir Rahmanir Rahim. Wassalatu wassalam ala Rasulillah. Sisters and brothers, Salamullahi alaikum wa rahmatuhu wa barakatuhu. I'm going to talk to you today about the Islamic worldview of medicine. I'm sorry I cannot be with you in person because of other competing commitments that I couldn't schedule to be with you today. But inshallah, we shall have other opportunities to meet. Now, Islam has got a view about everything because Islam is a complete system. So this applies also to medicine. The Islamic worldview is based on the Quran and Sunnah. And its practical expression is through the Sharia. As you know, Islam is a practical religion. So whatever worldview we have cannot stop at being a philosophical concept. We need to have it applied. And the Sharia is the practical application of the Islamic worldview. So the Islamic worldview is not an ivory tower concept above the heads of people. It's practical and is with us. Now, the source of the worldview is the doctrine of Tawheed al-Rububiyyah, because this concept says there's only one creator for the universe and its contents. Thus, everything that we do, including medicine, relates to Tawheed, as we shall see. Now, this worldview has many branches and ramifications. We cannot cover all of these, but we can discuss a few that have a direct relationship to disease treatment. First, I will talk about Tawheed itself. Tawheed is oneness of the Creator God, which means that the universe is one. La ilaha illallah Muhammadur Rasulullah. So this Tawheed encapsulates the Islamic worldview. It covers the whole Islamic worldview and is the basis for our civilization. Now, Tawheed is an intellectual challenge because the concept of one God above and beyond humans and the whole universe is an intellectual abstract. It's a reality, but it's an intellectual abstract because it's not a God that we can touch or see. So it's a challenge to understand it and appreciate it. But Tawheed has got the advantage that it gives us an integrating framework for the whole universe. Without the framework of Tawheed, there would be irreconcilable contradictions in the whole universe. So Tawheed puts everything together. Now, how does Tawheed put everything together? Because Tawheed is the basis for physical and social laws. These are called sunan. The sunan, the laws that govern the perfection, order, and harmony of the universe are from Tawheed. Now, these sunan guarantee that the world is harmonious. The human civilization is harmonious. Now, Tawheed is a guarantee of entry into paradise, but also it has got implications for our daily life here on earth. Because once we know there is one creator, then brotherhood, we are all created from one God, so we are brother, then we are equal. The physical laws of science and technology are from the same creator, like the law of gravity is a law of Allah subhanahu wa ta'ala from the same creator. Social laws, the laws that govern our human interaction, also from the same creator. So economic organization, political organization, the creator of the whole universe is the source of all of these things. That's why we say Tawheed is the basis of our culture and our civilization. Now, Tawheed has to do with a creator God and belief in one creator, Tawheed al-Rububiyyah, is an inborn thing. And it's a logical imperative. Because if there were two creators, the world or the universe wouldn't fit together so well without contradictions. As the Quran says, لو كان فيهما آلهة إلا الله لفسدتا فسبحان الله رب العرش عما يصفون. If there were more than one God, the whole universe would have been messed up, would be contradictory. Now, Tawheed al-Rububiyyah also explains the harmonious interactions in the ecosystem, the food chains and the food webs, and also the human body. I have already said that Tawheed is the basis for the fixed laws, Sunanullah fil Kawn. Some of these may be physical, some of them may be social. Now, the social sunan are permanent. As the Quran tells us, سُنَّةَ مَنْ قَدْ أَرْسَلْنَا قَبْلَكَ مِنْ رُسُلِنَا وَلَا تَجْلُ سُنَّتِنَا تَحْوِيلًا. The sunan were those that were there before us, and they do not change. وَلَنْ تَجِدَ لِسُنَّةِ اللَّهِ تَبْدِيلًا. They cannot be changed or interchanged. So, we need to obey the physical laws of Allah subhanahu wa ta'ala, like gravity. Nobody can say, I don't believe in gravity. If you don't believe in gravity, go on the top of a tall building and jump upwards. You will fall down. But also we need to obey the social laws. Usually we disobey the social laws, but we need to obey all the laws. Now, after having explained the overriding Tawhidic view of the world, let us just discuss concepts that relate to Tawheed in medicine. I chose only 3 of them, and they reflect Tawheed al-Rububiyyah. The first one is holistic care, al-Shumuliyah. Medical care should be comprehensive, covering the body and the mind, as well as other factors that affect health, social factors, family factors, spiritual factors. So the doctor should not treat a wound. The doctor should not treat a cancer. The doctor should not treat a fever. The doctor should treat a person, because this person has got a body, a mind, and other factors that are around him. So the doctor should have a holistic view of the person as a whole and provide holistic care. That is Shumuliyah. Shumuliyah comes from the concept of Tawheed. The second value that applies to medicine is purposive care, al-gha'iyya. All medical interventions must have a definite purpose and goal. Now, I want to state it that from the Islamic perspective, the goal of medical care is quality of life and not quantity of life. Our doctors and nurses are not there to prolong the life of patients. No, because the quantity of life is in the hands of Allah. Al-ajalu musamma. Allah fixes the ajal. When it is time to go, patients go. Return to Allah subhanahu wa ta'ala. But the health worker, doctor, nurse, physiotherapist, psychologist, psychiatrist, their job is the goal of quality of life. They are to work to give the patient the highest quality of life. So a Muslim doctor is quality oriented by definition. We must provide the highest quality of life for our patients. The third value is balanced care, at-tawazun, because in medical care, we should aim at balancing extremes and adopting the moderate or middle path. The problem is sometimes we undertake extreme interventions that end up causing more harm than the original disease. So we need to have a sense of balance between extremes and stick to the moderate middle path. As the Quran tells us, وَكَذَلِكَ جَعَلْنَاكُمْ أُمَّةً وَسَطًا لِتَكُونُوا شُهَدَاءَ عَلَى النَّاسِ. We were made a community balanced in the middle so that we can be witnesses on other communities. Now, let me go into more detail at what we mean by purposiveness. The problem is that in modern technology, each discovery leads to another discovery. Technology keeps on moving on. In medicine especially, technology is moving very fast. And everybody follows. Nobody asks the question, where are we going? Because you don't want to be left behind. And this is the problem. If we don't know the purpose, if we don't know the goal, where we are going to end up into a lot of problems. We are in a situation in which there is no overall vision where we are going. Like technology has become an automaton. In fact, actually technology drives us. We don't drive the technology. And we cannot stop it. And why? Because newer and newer technologies generate more revenues for the owners. So nobody asks the question, is this technology good? Where is it leading to? A situation where you don't know where you're going was termed by the Quran as abath. Yeah? As the Quran says, Surah Al-Sha'ra, أَتَبْنَ بِكُلِّ رُبٍ آيَةً تَعْبَثُونَ. This is abath, building things without knowing why are we building them. Because humans were created for a purpose and wisdom. So, أَفْحَسِبْتُمْ أَنَّمَا خَلَقْنَاكُمْ عَبَثًا. Do you think that we created you without an aim? No, there must be an aim. There must be clear goals. So we want to make sure that as we practice medicine, we keep the purposes clear. We don't have to pick up everything new because it is new, because some of them are going to lead to catastrophes, are going to lead to problems. We need to always keep the purpose in mind. The Arabic word for purpose is al-gha'iyya. Now, we come to the value of holism. The human being is a mixture. He's made up of a jasad, which is the material body, and the spiritual part, a nafs. So when we are treating a human being, we must approach him holistically. We treat the body, but also we treat the ruh. We treat the nafs. We consider them. Modern medicine focuses on the jasad, the body only. And this is the mistake that we Muslim practitioners of medicine should correct. Medicine should be comprehensive, covering the body and the spirit. Also, our treatment should be comprehensive. We can treat with materials like medicines and surgery, but also we can treat spiritually using dua and ruqyah. So this is a holistic approach that Islamic values impose upon us in the practice of medicine. Balance. Sometimes we are so busy with the immediate reality that we lose the balance that Allah intended for us in our life. Like, for example, when dealing with wealth, with money, وَالَّذِينَ إِذَا أَنفَقُوا لَمْ يُسْرِفُوا وَلَمْ يَقْتُرُوا وَكَانَ بَيْنَ ذَلِكَ قَوَامًا. When Allah is explaining Surah Al-Furqan, the character of the believers is that when they give, they don't give extravagantly. And also, they are not miserly. وَكَانَ بَيْنَ ذَلِكَ قَوَامًا. And they always try to find a middle way. We need to have balance. We need to know the balance between the rights of the body and the family. Sometimes we care too much about our body and forget about the family. And actually, even in medicine, sometimes you may have a patient you are treating. As you give them sedation, consider how much sedation to give. Maybe you don't give too heavy a dose because you want to leave them with the ability to communicate with their family. That's a balance that we need to consider. We need to think about emotional balance. So we need to always, in our procedures and processes, balance the benefits, al-maslaha, and the harm, al-mafsada. Any medical intervention, however small it may be, has advantages, but also has got disadvantages, side effects. A Muslim doctor balances the two. When something is beneficial, we do it, of course. When something is harmful, we do not do it. But when the two are there, because sometimes in one procedure, there is a benefit and there is a harm. So we will do the procedure if the benefit is more than the harm. We will not do it if the harm is more than the procedure. But if they are of equal worth, you really cannot say which is more in consideration, then we follow the principle of the Sharia that دفع المفاسد مقدم على جلب المصالح. Preventing harm comes before getting benefit. So it's more important to prevent harm than to get a benefit. So these are things that we should consider when we are doing our interventions. Thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh.